Wrist arthritis usually starts with pain, but it can also be swelling and often loss of motion at your wrist. Surgical treatment is usually the last thing we're doing, so you start to think about surgery when you've failed bracing, anti-inflammatories, and injections. When you do not have fully end-stage wrist arthritis, there are a lot of options. We can do partial fusions or actually even remove bones, but when you have total wrist arthritis or end-stage wrist arthritis, there's really only two options, a wrist fusion or a wrist replacement. Once you've undergone a wrist replacement, the goal primarily is to treat your pain. So pain relief should be quite significant, but it also salvages your motion, meaning you should still be able to move your wrist, probably not all the way, but more than if you got a fusion. Patients with wrist replacements are often some of my happiest patients. They've often gone through a really long journey to get to me and finally get that surgery. And so once they have the one surgery that sticks and really gets them back to doing what they like to do, they're incredibly happy. I love hearing and seeing all the things that they're doing with their wrists that they couldn't do beforehand.